Hi guys, my name is Gloria Doherty and I am a nurse practitioner. I've been a nurse practitioner for 20 years and I was a registered nurse 10 years before I was a nurse practitioner. I grew up in the Bronx in a state of poverty that I was not aware that I was in, with a single mom because my dad passed away when I was 3, and growing up with my aunts and uncles having chronic disease and all basically passing away before I went to high school, and my mom right after high school. So it set me up for a life of caring, a life of wanting to make a difference. But the one thing that my mom told me when I was growing up is that education is your only way out and your only way up. If you get nothing out of this presentation except for that, I hope that you take it home with you. In high school, I excelled in sciences and in math. And so it was a natural progression for me to go on to become a registered nurse. And then after being a nurse for so long, knowing what I wanted to do, I was always into surgery and into the adrenaline rush and trauma, et cetera. And so that is what I do as a nurse practitioner. There's all different types of nurse practitioners. There's family nurse practitioners, psychiatric nurse practitioners, geriatric nurse practitioners who take care of older people. And I'm an acute care nurse practitioner, which means I take care of people in the acute phase of whatever it is they might be going through. In my particular case, the predominance of my career was for surgery, open heart surgery, and for trauma. And now I predominantly just do critical care and medicine services in a hospital. So patients who come in not feeling well, and with all of this COVID that has been going around, those are the patients that I take care of. Being a nurse practitioner in a hospital is very similar in hours to being a nurse. You work basically 3 12-hour shifts per week, or for me, I work 11 shifts a month, regardless of how that's lined up. So I can work 6 days in a row and be off for 2 weeks and then work 5 days. So it is very flexible. It is very rewarding. Salaries are over $120,000 to start, and only goes up from there. So it's nice to be paid to do what you love. And so if you find your passion in this, I encourage you to seek it out. On top of your registered nurse education, it is a master's level education and now also doctoral. So as you grow in your nursing career and you choose to become a nurse anesthetist, a nurse midwife, or a nurse practitioner, you get to go back to school. Education is your only way out and up. So you would go back for your master's, and a lot of programs now are doctoral. I had 2 master's degrees, so I became a nurse specialist, which is very similar to a nurse practitioner, and have full ability to prescribe anything for patients. And then I went on to complete my PhD. So I can say, hi, I'm Dr. Doherty. I'm a nurse practitioner. I would never, ever pretend that I'm a medical doctor because I am not. I am a nurse practitioner, and I am very proud of being a nurse practitioner with nursing as part of my roots, and that center of caring and compassion and making a difference that you have to go along with that. The one thing that I learned that's very important in being a nurse practitioner is, in our state, we are independent, meaning I don't need a physician to supervise me. I can open my own clinic. I could have my own patients assigned to me once they come into the hospital until the time they go home. I have full ability to prescribe everything from prenatal vitamins to drugs that are habit forming and everything in between. But because it is not throughout the whole entire country that nurse practitioners are independent, I have learned to be very humble, and that you have to educate people. People usually make assumptions, and it's up to you to educate them about any misinformation that they may have heard about what it is you do, the things that you are capable of doing, even everyday life. in the things that you do today. I mentioned that there's all different types of nurse practitioners and advanced practice nurses, and the ability to do so many things as a registered nurse. It's not only at the bedside or in your practice, but you also have room for growth through administrative means, like being an office manager, but also being the nurse practitioner, being a medical director, all of those things. So I hope that you remember that if you take anything away from this presentation, other than how awesome it is to be a nurse and how it is such a great career that grows into being a nurse practitioner or another advanced practice nurse, that education is your only way out and up. And I hope that you work hard and that you find what comes natural for you and that you find passion with that. So thank you all, good luck, and I hope to meet some of you. Bye-bye.